And as Sarah was saying just throughout the morning, we've been talking about the latest news on the vaccines and the uptick in cases of the coronavirus in and around Texas and around the country.
And there are still so many questions. That is why we are joined live with Dr. Robert Leverence from the UT Health San Antonio. Once again, good morning, doctor. And we talked about...
Thanks again for having me.
Not a problem. We talked about the new vaccine approval, and there's a big difference between these vaccines, the Pfizer vaccine and the Moderna vaccine.
Well, the main difference is really logistical, and that's more for us to deal with in administration, and that is the Moderna vaccine doesn't require the ultra-cold storage, and that's a big advantage because you can get the vaccine out to smaller pharmacies and practices, whereas right now that's really hard to do with the Pfizer vaccine. Otherwise, though, the Moderna vaccine is an mRNA vaccine, as we say, so it's very similar in technology to the Pfizer vaccine. And so its effects and properties should be very similar as well, meaning that it's highly effective, it requires a second dose, the safety profile appears to be very good like the Pfizer vaccine. So to the general public, it should look very similar, but more available once it's available.
Now, Dr. Leverence, we're at this unique point where, yes, 2 vaccines have been approved, but we're still in the midst of this pandemic. We've seen an uptick. We've seen a surge. So from your perspective, from a medical perspective, what have our hospitals looked like? Give our viewers kind of an inside look at what you guys are seeing.
Boy, Max, I'm sure glad that we have this vaccine to talk about, because otherwise the story of this pandemic continues to be very grim. We're clearly at the worst point in this pandemic with the highest number of hospitalizations across the state and across the country. Here in San Antonio, this surge has not yet approached the level that the summer surge approached, but I wouldn't be surprised at all if by Christmas and New Year's we were at a similar level and contemplating reopening a field hospital. So this is still very concerning. The only good news is that, hey, we know that public health mitigations work. What I mean is, hey, we know the drill. You know, wear your mask, wash your hands, distance from other people, stay home if you don't need to go out. Those things work. So this vaccine isn't going to have a huge impact, probably very minimal impact on this current surge. And so, boy, oh boy, we need to be mindful throughout these holidays and continue to do the good things that have kept many people safe here thus far.
And Dr. Leverence, you're just talking about that surge from Thanksgiving. Now Christmas is approaching this week. Is it safe to gather with family members outside of your household, especially not wearing masks?
Well, ideally, it would be best not to gather with those folks outside your household. On the other hand, though, if you so choose to gather with folks, and we understand that some folks will, and so if that's the case, though, please practice safely. Avoid buffet-style meals so that not everyone is touching the same spoon. Wear a mask if you're in the house. If it's a nice day, have the meal outside. And of course, wash your hands. And folks from similar households should be sitting nestled together rather than mixing people up. So sure, if folks do choose to gather, boy, do it safely. There's still ways to stay protected and keep your family members safe.
Dr. Leverence, thank you so much for your time again this morning. You can see his full interview, especially from the 8 o'clock hour as well, on ksat.com later this morning. Thank you, Dr. Leverence.
All right, thanks for having me.